All right, team, let's talk babies. Not the cute Instagram kind, but the ones with fundal heights, fetal heart tones, and moms who need a nurse that knows when something's not right. Pregnancy isn't just a miracle. It's a monitoring marathon, and the NCLEX wants to know if you can keep mom and baby safe through every trimester. You ready? Let's go. So let's get into pregnancy basics. Know the trimesters. First trimester, weeks 1 through 13, organ development, high miscarriage risk, morning sickness. Second trimester, weeks 14 through 26, baby bump, movement is felt, and routine screenings begin. And then third trimester, weeks 27 through 40, growth spurt, discomfort, and labor prep. So here's an NCLEX tip to remember. Know what's expected versus what is a red flag in each of the trimesters. So let's get into our prenatal visit checklist. What gets done at nearly every prenatal visit? Well, weight and blood pressure to start with. Fundal height, because after 20 weeks, we should match weeks of gestation plus or minus 2 centimeters. Fetal heart tones, heard by Doppler around 10 to 12 weeks. And then urine dipstick. Check for protein, because protein equals preeclampsia risk. So here's our pro tip. First prenatal visit equals baseline labs, blood type and Rh factor, HIV screen, rubella titer, and education galore. Remember, you need to educate your patients on this process. So what are these danger signs that we need to be on the watch out for? Because the NCLEX loves to test your ability to spot trouble. So the rule is call the provider if sudden weight gain, edema, headache, and vision loss. You need to be thinking preeclampsia. Vaginal bleeding or fluid leakage, decreased fetal movement, severe abdominal pain or cramping, and then fever or chills. So here's a funny reminder that you can give your patient. If it leaks, bleeds, or blurs, you need to call us and let us know. So what are some of these high-yield labs and screenings that we need to be on the watch out for? Well, Rh negative moms get RhoGAM at 28 weeks. And within 72 hours postpartum if the baby is Rh positive. Glucose tolerance test at 24 to 28 weeks for gestational diabetes. And Group B strep screenings at 35 to 37 weeks. If positive, give penicillin during labor. Here's an NCLEX tip. A mom with gestational diabetes, we need to watch the baby for hypoglycemia after delivery. So let's get into nutrition and parental supplements for our expecting mothers. So what do we do with these calories? Well, we increase them by 300 a day in the second and third trimesters. Folic acid, 400 to 800 micrograms daily to prevent neural tube defects. But what do we need to avoid? Well, let's start with deli meats, unpasteurized cheese, and high mercury fish. We also want to stay away from the alcohol, the tobacco, and the excess caffeine. So here's an NCLEX tip to remember. Pica, craving non-food items like clay or ice. We need to be on the lookout for iron deficient anemia. So let's get into an NCLEX question. You ready? A pregnant client at 32 weeks reports a headache, blurred vision, swelling in her hands and face. What's the priority? We check her blood pressure, ask about her stress level, suggest rest and fluids, document and monitor. Take a moment and pick your answer. In this case, the answer is A. We check her blood pressure. These are classic signs of preeclampsia. Priority is confirming and acting fast. So here's some nursing gold to remember. Prenatal care is prevention in action. The better you monitor, the more you protect. Not just one life, but two. So great job. You've made it through the bumpiest ride in nursing, pregnancy. Just remember, every fundal height, every kick, every lab value tells a story, and your job is to listen. Coming up next, newborn and pediatric nursing elements, because those babies grow fast, and you need to be ready to keep them safe on the outside too. Great job. Go do your exercises. I'll see you right back here for the next video.